Brenda Woodmansee. I'm going to be your USA College of Nursing student nurse, and I'd like to do your cardiovascular assessment today, if that's okay. It's nice to meet you. Okay, I'd like you to take your shirt off, but don't really do that, and lay down in the bed with your head down that way on your back, and we will proceed. So, just get comfy. Too bad we don't have a pillow. So, first thing I'm going to do is inspect. So I'm going to look for the apical impulse, which I actually do not visualize, but it would be found at the fourth or fifth intercostal space, mid-clavicular line, or a little bit medial there too. While I'm inspecting, I'm also going to look for any lifts and heaves, which is caused by forceful ventricular contraction, but I don't see those either. While I'm standing here talking about inspection, I'm also going to say that part of cardiac assessment is to check the heart rate and rhythm. And the normal heart rate in an adult is 60 to 100, and it should be regular rhythm. I would also state that the apex of the heart is found at the fifth intercostal space, mid-clavicular line, or a little bit medial there too, and the base of the heart is found at the second intercostal space to the right and left of the sternal border. Now I'm going to move to palpation, which is the second part of an assessment. I'm going to use the pad of one finger, and I'm going to palpate the fourth or fifth intercostal space, mid-clavicular line. So I'm going to find her sternal notch and go down here and kind of find her second intercostal space and move down and come over here. Now I'm going to have you take a deep breath and exhale and hold it. Okay, you can breathe. I actually couldn't palpate it, so I'm going to have you tilt just a little bit to that side, not turn all the way over, but just enough to kind of throw your heart against your chest wall. And I'm going to have you take a breath and exhale and hold it. And I'm going to try to palpate it again. Okay, I did palpate it. Okay, you can roll back. I palpated the apical impulse at the fifth intercostal space in the mid-clavicular line. Now, done with palpation, I'm going to move on to auscultation, which I'm going to do with my stethoscope. And I'm going to be auscultating the four auscultatory areas where you hear the valves close. And those are the aortic, which is found at the second intercostal space to the right of the sternal border. And then the pulmonic, which is found at the second intercostal space to the left of the sternal border. And then, let's see, make sure I'm in the right place. Third, the tricuspid is usually found at the fourth or fifth intercostal space to the left of the sternal border. And then the mitral is found where we were palpating before at the fourth or fifth intercostal space in the mid-clavicular line, or just a little bit medial there too. So those are the four places that I'm going to listen: the aortic, pulmonic, tricuspid, and mitral. And I'm going to now listen with my diaphragm. Okay. I'm listening for S1 and S2, and also for any extra heart sounds or murmurs. Now I'm going to listen with my bell. All right. I heard S1, S2, no extra heart sounds, and no murmurs. So now I'm going to discuss the oscillatory relationship between S1 and S2. S1 is the lub and S2 is the duct. S1 is the beginning of systole and S2 is the beginning of diastole. S1 is the closure of the AV valves, which are the mitral and tricuspid valve, and S2 is the closure of the semilunar valves, which is the pulmonic and aortic valves. S1 is heard loudest at the apex and S2 is heard louder at the base. Okay. So now we're going to check your pulse deficit. And I'm going to do this by, I'm again going to auscultate your apical impulse, and I'm going to have you turn your head this way, and I'm going to palpate your carotid pulse. There it is. All right. There's there's no pulse deficit. Okay, and now we're gonna listen for carotid bruits. I'm gonna listen with my bell. Okay? And I'm gonna have you, when I get ready, what I'm gonna have you do is turn your head away from me. I'm gonna listen to this side first, and I'm gonna have you take a breath, exhale, and hold it. And I'm gonna try to go fast because you're holding your breath. All right, so now take a breath and exhale and hold it. Okay, you can breathe. I'll give you a minute to recover. Then you're gonna look towards me and do the same thing again. No bruits. No carotid bruits noted. So that's good. All right. So now we're going to check pulses. First, we'll just start over here since you have your head turned this way, and I'm going to palpate your carotid pulse here. All right. I'm going to have you turn your head this way. Remember, I'm doing one at a time on this one. Okay. Now I'm going to flatten out your arms, and I'm going to check your brachial pulse. Same time. And now I'm going to check your radial pulse. And now I would have to have you straighten your legs out and check your femoral pulse. We're not really going to check the femoral pulse for the check-off today, but I am going to verbalize that it's located below the inguinal ligament, halfway between the pubis and the anterior superior iliac spine. And I would check that bilaterally. And then I would go down here. I might have to take off your shoes. Uh-oh. Are they double knotted? You might want to get your SP to take off their shoes first. If you think about it. Maybe they already have them off. All righty. You know what you were getting in for. Take people's clothes off as much as we can. There we go. Take this off. All right. This is dorsalis pedis pulse. This is posterior tib. Okay. I'm going to let you lay your legs down. So all of our pulses were 2+ and equal bilaterally. This would have to be gone, but I'm going to go upper legs, just kind of pushing down to check for any edema, and I don't see any swelling or any pitting edema. Then I'm going to go up here, and I'm going to look at her fingernails. I'm going to lift them up a little bit above her heart, and I'm going to note that her color is pink, no cyanosis or pallor, and that her nails are convex. Her capillary fill time is about 1 second, so that's good. And she has a less than 180 angle on her nail bed. And I'm going to have you do this little gadget right here. There's a little tiny diamond there, so that means no clubbing. So let me just pause for a minute. I think this concludes my cardiovascular assessment. Thank you so much for your help today. You can put your shoes back on.